Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. Well, this time of year we all hear about holiday pops, but what about holiday knots? Yeah, that stress and tension that seems to come up every year around this time. Well, at Maragal Medical, we have solutions to help keep those muscles nice and relaxed. We're going to talk to you today about myofascial trigger point injections. Some great information coming up, so stay tuned. Okay, Dr. Mike, I mean, we've all been there, that crazy tension, those knots that seem to just kind of come out every now and then, especially this time of year where the schedule's so crazy. What are those knots and how do they form and what can we do to help prevent them and get rid of them from the long term?
As you described the knots, it's just that area of muscle we can feel. It's really tight. It's usually very focused. You know, someone touches classically in these muscles in the upper neck and upper trapezius muscles. They're really an area of tight muscle bands that lost a little blood supply. And they get actually ischemic, which means the lack of blood supply in that area. So it creates a process where the muscle fibers don't really contract and relax and open and close as they're supposed to do.
Yeah.
So they get tightened up in that little area along the length of the muscle, and then they become painful. So
Yeah.
that's what happens, like again, when a person may have a heart attack, which is not a knot for
Right,
sure,
right.
but it's a lack of blood supply, and then there's heart damage, there's a muscle damage of the heart. Well, it's not a lot of damage in the muscle that kind of works in these muscles of the shoulder or what have you.
Yeah.
But it does get painful because there's decreased blood supply. We're trying to get them to relax, get that blood back in there so the pain can go away and that knot, so to speak, can calm down.
Yeah, and we've got a great solution. We offer a variety of different types of injections. Of course, the regenerative injections with the Wharton's jelly allograft, and then those PRP injections. But we also do those trigger point injections. But as most of you know, we're more of a holistic clinic. We take a holistic approach with everything. Instead of using a medication with those injections, we actually use a natural product called Serapin. And Serapin is great because it's plant-based. It's actually an extract from the pitcher plant. It does a really good job of, getting those muscles loose. And then, in terms of prevention, really helps our chiropractors, Dr. Sherman and Dr. Brooks, to get a better adjustment in. And then usually it's because of poor posture, and that's where Colleen comes into play, my wife and our physical therapist. She can work on really, addressing some of those postural faults so that those trigger points or knots don't come back again.
That's true, and we think about just the posture, we think about standing or sitting, but as the holidays are around, again, we're reaching up into cabinets, we're putting up kind of decorations, all that stuff elevates the shoulders, we're carrying bundles. Those things really can also exacerbate these muscles because they're constantly being contracted and not in the right position.
Right.
That is what we want to do to try to reassess the concept. How is your mechanics? What are you doing for your movements? And that's where, again, once we get those knots kind of calmed down, we do the trigger point injection. No question, we get the therapy, we get the chiropractic, we get that motion back. Really kind of relieves a lot.
Yeah, it's a great combination. If you're suffering from myofascial pain or trigger points, or simple terms, those knots in the upper back or really anywhere in the body, definitely want to call our office and come in to see Dr. Marciello or his nurse practitioner Molly for a thorough evaluation. We can definitely help you out. More information is always available on our website at maragalmedical.com. And certainly consider subscribing to our YouTube channel. Wealth of information there, and that will be able to point in the right direction. Best of yet, we take most insurances. Well, that's it for today. Hope you have a great day, everyone. We'll talk with you soon.
Take care.